This medication is used to treat conditions like growth failure, growth hormone deficiency, short bowel syndrome, and HIV-related weight loss or wasting. It is also used to increase height in children with disorders such as Noonan syndrome, Turner syndrome, and idiopathic short stature. The daily dosage and optimal timing for taking this medication should be discussed with your healthcare provider. Before starting to use Saizen Vial, it's important to read the patient information leaflet that comes with the medication. Consult your doctor or pharmacist if you have any questions. Saizen Vial may be given by injection into a muscle or under the skin, depending on the brand. It's important to change the location of the injection site to avoid problem areas under the skin. Make sure to use the medication exactly as prescribed by your doctor and follow their instructions closely for best results. The dosage of Saizen Vial is based on your age, weight, medical condition, and response to treatment. If you are giving this medication to yourself at home, learn all preparation and usage instructions from your healthcare professional. Do not shake the solution while mixing it, and check the product visually for particles or discoloration before using it. If you are using a pen device, do not share it with another person, even if the needle is changed, to avoid the risk of serious infection. If Saizen Vial is used for short bowel syndrome or weight loss/muscle wasting, consult your doctor for any special diet or nutritional supplements that may be helpful. It may take up to 2 weeks to notice the effects of Saizen Vial if it is used for weight loss/muscle wasting. Make sure not to use more of this medication than prescribed or use it more often, as this may increase the risk of side effects. If you experience headache, nausea, vomiting, tiredness, muscle pain, or weakness while using Saizen Vial, it's important to inform your doctor or pharmacist. Remember, your doctor has prescribed this medication because they believe the benefits outweigh the potential side effects. Some people may experience serious side effects, such as persistent nausea/vomiting, unusual tiredness, or changes in vision. It's important to tell your doctor right away if you experience any of these symptoms. Children with Prader-Willi syndrome may be at risk for rare, but potentially fatal lung/breathing problems when using this medication. It's important to monitor for signs of upper airway obstruction, such as heavy snoring or irregular breathing during sleep. Additionally, somatropin may increase the risk of developing tumors or cancer, so it's important to discuss the potential risks and benefits with your doctor. While very rare, a serious allergic reaction to this medication is possible. If you experience symptoms such as severe swelling, dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other unusual effects. Before using Saizen Vial, it's important to discuss any allergies with your doctor or pharmacist, as well as any medical history of adrenal gland problems, eye problems, recent major surgery or injury, breathing problems, diabetes, obesity, kidney disease, cancer or tumors, thyroid problems, or back problems. If you have diabetes, it's essential to monitor your blood sugar levels regularly, as this medication may increase your blood sugar. When giving this medication to newborns, it should be mixed with sterile water for injection that does not contain a preservative. It's important to inform your doctor or dentist about all the products you use before having surgery. Older adults may be more sensitive to the side effects of this drug, especially effects on blood sugar or swelling in the ankles or feet. During pregnancy, this medication should only be used when clearly needed, and it's unknown if it passes into breast milk, so it's important to consult your doctor before breastfeeding. When taking Saizen Vial, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It's crucial to consult with your doctor before starting, stopping, or changing the dosage of any medicines while using Saizen Vial. Additionally, it's important to note that somatropin, the active ingredient in Saizen Vial, is very similar to lonapexamitropin. Therefore, it's advised not to use medications containing lonapexamitropin while using somatropin. Be sure to follow your doctor's recommendations and guidance when taking Saizen Vial to ensure its safe and effective use. Remember to take the prescribed dosage at the recommended times for optimal benefits. If you or someone else has taken too much Saizen and has serious symptoms like passing out or trouble breathing, call 911 immediately. Otherwise, contact a poison control center right away. In the US, you can call 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of overdose may include severe headache, severe nausea or vomiting, signs of low blood sugar, such as sudden sweating, shaking, confusion, and ongoing swelling of the hands and feet. It's important not to share Saizen Vial with others. Your doctor may schedule lab and medical tests while you are using this medication, such as eye exams, thyroid function, glucose levels, and growth hormone antibody levels. It's important to attend all of these appointments. If you have any questions or concerns, consult your doctor for more details. Make sure to take Saizen Vial as directed by your doctor. If you happen to miss a dose, consult your doctor or pharmacist for a new dosing schedule. Do not take a double dose to make up for a missed one. Be sure to consult the product instructions and your pharmacist for specific storage details. It's important to keep all medications out of reach of children and pets. When it comes to discarding the product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Make sure to properly discard the product and it is expired or no longer needed, and consult your pharmacist or local waste disposal company for the best way to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.